More than 1.1 million people in Missouri have received at least one dose of the COVID-19 vaccine. Experts say it's important, though, to listen to those who are still reluctant.
I think everybody comes from their viewpoint from a real place, and being able to just listen and empathize and try to understand why, some of that hesitancy exists is the first step.
Next, cite some history. Try sharing successful accounts of how vaccines have improved society. Many older adults remember when the polio vaccine was first introduced in 1955. And thanks to those vaccinations, polio is no longer a threat in the U.S. Step 3, address misconceptions.
A lot of people are on the fence because they feel like the vaccine was made too quickly and corners were cut. And I say, what you probably don't realize is that, we completed all the steps. We were able to complete those steps faster because we were doing a lot of the steps at the same time.
Government funding allowed manufacturers to start producing vaccines while they were still in clinical trials. Plus, researchers had a head start.
It's not the first coronavirus. It's not the first, outbreak of coronaviruses. We had SARS, we had MERS, and people had started creating vaccines for that.
And trials have shown the vaccine's safety.
But they were developed in a very safe fashion. Unbelievably low incidence of any side effects, except for very minor ones like sore arms.
Finally, invite future conversations, even if your friends aren't convinced right now.
Maybe right now is not the right time, but it doesn't mean that at some point, that person may be interested too. So providing resources, leaving the door open for future.
Bringing us one step closer to getting the pandemic under control. From the University of Missouri, I'm Teresa Snow.